have patients who have taken sedatives for years or even decades with a strong relationship with their sleeping pill, seeing it as necessary even if their sleep isn't to their satisfaction. Any rebound insomnia when missing or reducing doses has only served to reinforce their ongoing use. They may have concerns about taking sleeping pills long term, but don't feel that they have any choice. They often feel stuck. This video describes what you can mention and share when introducing CBTi as a more effective and safer way to treat insomnia and prevent its return, while also making it easier to stop sedatives. It's a good idea to watch a couple of our other videos in this series for clinicians for a description of how to approach sedative deprescribing with your patient and also how to introduce and help your patient get started with CBTi. This video focuses on how you can help your patient do both at the same time, gradually reduce sedative use while working through a CBTi program. One of the most common questions we hear is, can I start CBTi while taking sleeping pills? The easy answer is yes. And when to start CBTi can vary. For some, it makes sense to start a course in CBTi before initiating a gradual dose reduction plan, especially for people not sleeping well. CBTi can be used to improve sleep and increase confidence that stopping sleeping pills can be done safely over several weeks or months and without making sleep worse. For other patients, it makes sense to initiate the gradual dose reduction plan and start the CBTi program later. Some suggest waiting to see if your patient experiences a return or worsening of insomnia symptoms as the dose is gradually reduced. If this happens, it's a good time to start the 4 to 8 week CBTi program. It really is up to the patient and when they feel ready to overlap the two processes. And of course, if the sedative is successfully deprescribed without the use of CBTi and insomnia returns later, a CBTi program can be initiated at that time. Here are a few phrases to consider trying out, using your own words and style to start or keep the conversation going. I think now is a good time for us to explore ways for you to get a better sleep and end your need for sleeping pills. The approach involves reducing your sleeping pill dose slowly over several weeks or months. To improve your sleep, I recommend that you learn about and start using the sleep-enhancing techniques of cognitive behavioral therapy for insomnia, or CBTi. You can start your course of CBTi sleep therapy at any time, whether it's before starting to reduce your sleeping pill dose or after you've started the process. To help you understand how sleeping pills and CBTi compare, take a look at this chart. It will answer lots of your questions about them. Many people learn the sleep-enhancing techniques of CBTi on their own. Visit Sleepwell's CBTi page to learn more about it and take a look at Sleepwell's recommendations for suggested CBTi programs. Take a look at this video's Sleepwell prescription for a list of useful resources to help your patient transition from sleeping pills to CBTi. You can share it with them as is or modified to your liking.